You brush your teeth, maybe floss if you have the time, and you probably think your mouth is perfectly healthy as long as nothing hurts, right? But what if I told you your mouth is actually the biological gateway to your entire body? It's true. Modern medical science has uncovered something absolutely fascinating. A silent, low-grade infection in your gums might literally be accelerating aging throughout your entire system. So is your daily brushing routine just about, cosmetic upkeep and having fresh breath for the grandkids? Think again. As we pass 45, and especially as we enter our 50s and 60s, decades of cumulative wear and tear, plus some totally natural changes in our saliva and immune response, make us highly vulnerable to periodontal or gum disease. And as we're going to see from the research today, the bacteria and inflammation that start in your gums, they don't just stay in your mouth. They can actually enter your bloodstream and travel straight to your heart and your brain. I want you to think of your mouth not just as a mechanical tool for eating, but as a really complex, bustling ecosystem. Your oral microbiome is made up of literally billions of bacteria. And when they're balanced, these bacteria are your best allies. They even help regulate your blood pressure and shield you from harmful pathogens. But when the harmful bacteria take over, they cause gingivitis, which is just a fancy word for gum inflammation. And if we leave that unchecked, it progresses to periodontitis. That's where the gums actually start to pull away from your teeth, creating these deep, hidden pockets of infection. And look, this is not some rare issue. Data from the CDC shows that a whopping 70% of adults over the age of 65 have some form of periodontal disease. So if you're dealing with this right now, please know you are absolutely not alone. It's incredibly common for our age group, but here is the best part and the biggest takeaway. It is highly preventable and totally manageable once you have the right information. So what physical signs should we be looking for? First up is bleeding gums. A lot of folks just assume, oh, I'm brushing too hard. But healthy gums are firm, pale pink, and they just don't bleed. When plaque builds up, your immune system rushes white blood cells to the area to fight it off. This causes swelling and fragile blood vessels that rupture super easily. So bleeding is a literal red flag. Second is chronic bad breath. We're not just talking about morning breath here. This is a persistent odor caused by anaerobic bacteria churning out volatile sulfur compounds deep below the gum line. And third is receding gums, where your teeth might suddenly start looking a bit longer. This happens because chronic inflammation forces your immune system to actually break down the bone and connective tissue that hold your teeth in place. And that brings us to the fourth sign. This one highlights a really common, yet often totally overlooked challenge for us older adults, and that's dry mouth. After 45, a lot of us naturally start taking medications to support our blood pressure, cholesterol, or allergies. And dry mouth is a side effect of literally hundreds of these medications. Your saliva is your mouth's natural defense system. It washes away food and it's packed with antimicrobial enzymes. When your saliva drops, harmful bacteria multiply like crazy. Now, if you experience this, it is absolutely not your fault, but it is something we need to actively manage to protect those teeth and gums. Take a look at this quote. It perfectly captures the whole core of the mouth-body connection. If you're dealing with unexplained high blood pressure, stubborn blood sugar levels, or maybe increasing brain fog, well, your gums might actually be a hidden culprit. Every single time you chew your food or brush your teeth when you have periodontal disease, millions of bacteria and inflammatory markers like C-reactive protein are getting pushed directly into your bloodstream, traveling throughout your entire system. And the established science really backs this up. The Alzheimer's Association reports that researchers have actually found the bacteria P. gingivalis, which is a primary cause of gum disease, in the brains of Alzheimer's patients. On top of that, the American Heart Association associates severe gum disease with a much higher risk of clogged arteries and cardiovascular issues. Your mouth and your body are constantly talking to each other, which is exactly why supporting your oral health is such a foundational step in aging with strength and independence. Fix number one is changing exactly how you brush, using the dentist-approved modified Bass technique. Most of us just scrub really hard back and forth, right? But that actually damages aging gums and totally misses the bacteria hiding under the gum line. So instead, grab a soft bristled brush, angle it at 45 degrees right toward the gum line, then use really gentle, tiny circular vibrations. It's like a mini massage for your gums that dislodges the plaque without all that destructive scrubbing. Do this gently for 2 full minutes. Remember, gentle is effective, harsh is destructive. Now, here is a pretty surprising realization. Brushing alone just isn't enough. It only cleans about 60% of your tooth surfaces. That other 40% is hidden out of sight in the gaps between your teeth, which, wouldn't you know it, is exactly where gum disease starts. For adults over 45, especially if you have a little bit of gum recession, using a water flosser on a low to medium setting at a 90-degree angle, or using those soft rubber-tipped interdental brushes is just a wonderfully safe and effective way to clean out those hidden spaces. Fix number 3 is all about protecting that oral microbiome we talked about earlier. A lot of harsh commercial mouthwashes act like a nuclear bomb in your mouth. Sure, they destroy the bad bacteria, but they completely obliterate the good bacteria too. And we really need those good guys. They convert dietary nitrates from things like leafy greens into nitric oxide, which actually helps lower your blood pressure. So instead of those harsh alcohol rinses, consider safe alternatives. A natural saltwater rinse is great, or a mouthwash containing xylitol, which is a natural compound that effectively starves the harmful bacteria without ruining your beneficial microbiome. So, the really crucial point to understand here is that once soft plaque hardens into tartar, which is also known as calculus, no amount of brushing or flossing at home is going to remove it. Tartar basically acts like concrete. It physically irritates your delicate gum tissue and keeps it in this constant state of chronic inflammation. To remove it safely, you really need a professional partnership with your dental hygienist for scaling and root planing. And that brings us to the magic number 6. You want to aim for a professional dental cleaning every 6 months, or every 3 to 4 months if your dentist has actually diagnosed you with periodontal disease. I really want you to reframe how you think about going to the dentist. It's not just about keeping your teeth looking pretty. A professional cleaning acts as a literal full-body inflammation reset that has been shown to reduce those systemic markers of inflammation floating around in your bloodstream. Now, at Vital Elixir, our highest priority is always your safety and well-being. And that means being completely honest about the limitations of any explainer. The information we've covered today is for educational purposes, to empower you, but it is never a substitute for professional medical advice. If you take medications, have chronic conditions, or if you're experiencing severe symptoms like persistent bleeding, loose teeth, or pain, please consult your licensed dentist or healthcare provider immediately before making any significant changes. Taking care of your gums is actively protecting your heart, your brain, and your metabolic health. It is all about maintaining your energy and your independence for years to come. We would absolutely love to hear from you, so take a look at the question on the screen and let us know your routine in the comments down below. If you found this structured explainer helpful today, please go ahead and hit that like button and subscribe so you never miss our evidence-based guidance for aging with strength and vitality. I'm going to leave you with this final thought. What if the secret to a sharper mind and a stronger heart has been hiding right behind your smile this whole time? Thank you so much for learning with us today.
Thank you for your time. Subscribe for more health education. Like the video and share it to help others stay informed.